Do you feel exhausted after eating sugary foods? Here are 5 simple fixes. Did you know that feeling exhausted after eating sugary meals could be a sign that your body is actually struggling in managing sugar? The good news is that there are ways to fight back. Today, we will explore 5 ways to add physical activity to your life for improved blood sugar control. Hello again and welcome to my YouTube channel, Dr. Hanz MD, where we 10x your success by optimizing your health. This episode is part of a series dedicated to sugar management. Blood sugar or glucose is the body's primary source of fuel. After we eat, our bodies break down carbohydrates into glucose, which enter the bloodstream. Insulin, a hormone produced by the pancreas, acts as a key, unlocking cells so glucose can be absorbed for energy. When we lead a sedentary lifestyle, the glucose in our bloodstream remains underutilized. Over time, this leads to accumulation of glucose in various organs, including the eyes and the kidneys. High blood sugar levels can damage the tiny blood vessels in the retina. This damage can lead to vision problems and even blindness. The kidneys play a crucial role in filtering waste products from the blood. Persistent high sugar levels can damage the small blood vessels in the kidneys, and this affects their function. Over time, this can progress to kidney failure. In addition to retinopathy and kidney disease, persistently high blood sugar level can also lead to a host of other complications, such as nerve damage, heart disease, and foot ulcers. Regular physical activity utilizes the glucose in our bloodstream to help improve insulin sensitivity, promote weight management, and reduce the risk of this serious complication. Educating yourself about the link between physical activity and blood sugar control empowers you to stay on top of your health. Here are 5 ways to incorporate physical activity into your day. If you do this, you'll have better blood glucose control. Number 5, make exercise a daily habit. As previously mentioned, when you're exercising, your muscles actively consume more glucose than when they are at rest. Exercise makes your cells more receptive to the effects of insulin. The greater uptake of blood sugar into your muscle cells naturally improves the regulation of your blood glucose level. This effect can last up to 24 hours after exercising. While occasional exercise has its benefits, to optimize the 24-hour effect of blood sugar, schedule exercise every day or on most days of the week. Treat daily physical activity as you would any daily appointment until it becomes second nature. It doesn't even have to be strenuous. Low to medium impact exercises like brisk walking, swimming, and dancing are incredibly effective in managing blood sugar. Number 4, take a walk after meals. Not everyone has time for a daily 30 to 45 minute walk, and that's perfectly fine. If you can find pockets of 10 to 15 minutes a day, you could reap the same benefits, if not more. A study published by Diabetes Care in 2013 found that in pre-diabetic seniors, 3 15-minute bouts of walking after meals were actually more effective in controlling blood sugar levels within a 24-hour period than a single 45-minute session. This may be because sugar spikes are more common after meals, and moving your body during this window allows your muscles to immediately take up the released glucose. Although a walk outside is ideal, especially during daylight, you could choose to walk indoors after dark or during bad weather. You can use your treadmill while watching one of my videos, or simply march in place as you listen to music. Whenever your muscles contract during exercise, cells take up glucose and use it for energy, helping attenuate sugar spikes. Number 3, add strength training. Strength training adds another powerful tool for blood sugar control. When you perform resistance training, you're creating microscopic tears in your muscle fibers. which the body rebuilds. This process requires energy, which the body gets by pulling glucose from your bloodstream. A long-term study published in the Mayo Clinic Proceedings Journal showed that strength training and increased muscle mass reduce the risk of developing type 2 diabetes by 32%. If you're a beginner, aim for at least 2 strength training exercises per week, targeting your legs, back, chest, core, and arms. Work on different muscle groups on each session. And remember to allow your muscles rest days for recovery. Gym with top-of-the-line weight machines is fantastic, but you can also benefit from free weights or resistant bands at home. Or you can even use your own body weight at the park. Number 2, get off the couch. Pressed for time? Don't underestimate the effect of small bursts of activity. Did you know that even a 2-minute walk can positively impact blood sugar control? Resisting the sofa right after a meal can make a lot of difference. In fact, according to a 2022 study in the Journal of Sports Medicine, walking as little as 2 to 5 minutes after a meal can lower your blood sugar. The study showed that when people went for the short walks after eating, they experienced their blood sugar levels rise and fall more gradually. After meals, walkers have more stable insulin compared to participants that remain seated or standing. So you should fight the urge to immediately hit the couch after eating and make a conscious effort to get up and move after a couple of minutes. You can add these micro walks and quick physical activity breaks to the recommended 150 minutes of exercise each week. These movement snacks can help counteract the negative effects of prolonged sitting throughout the day and mitigate blood sugar spikes and crashes after meals. And finally, for number 1, activate your soleus muscle. Here's another hidden gem. There's an easy exercise that can lower your blood sugar level as well as improve fat metabolism. It's called the Soleus push-up. This move targets the deep calf muscles called the soleus that's found below the back of our knees. It's easy to execute and you can do it for hours without the fatigue that comes with an intense cardio session. To do a Soleus push-up, sit in a chair with your feet flat on the floor. Push your toes against the ground as you raise your heels. Lower your heels and repeat. Researchers have found that Soleus push-ups increases oxidative metabolic rate, the rate at which the body uses oxygen to convert fat into carbohydrates and energy. In a 2022 study, participants who consistently performed Soleus push-ups saw a 52% improvement in blood sugar regulation after having a glucose drink. In addition, an increase in metabolism levels have been observed. The study was actually led by Professor Mark Hamilton and published in the journal iScience. The best part of doing Soleus push-ups is that you don't need equipment. You don't even have to change into your gym clothes. They can be done just about anywhere, behind your office desk, at the dinner table, or even while watching Netflix. Soleus push-ups are not meant to replace your regular cardio workout, and it's best to incorporate them into a larger exercise routine, along with other workout options that works best for you. That wraps up our list. Physical activity is a powerful tool for managing blood sugar. By incorporating regular exercise into your routine, you can significantly reduce your risk of developing type 2 diabetes and its complications. Before starting or modifying any exercise routines, consult with your doctor and a qualified fitness professional. It's important to be aware of potential risks, particularly in engaging in strenuous prolonged activity. Your healthcare provider can help you design a safe and effective program, which is tailored to your needs and fitness level. How do you stay active? Do you hit the gym for hours? Are you more of a daily gardener? Whether it's a competitive game of tennis or a quick hike with your dog, all movement counts. Think of it as your daily pill against high blood sugar. Share your favorite ways to stay active in the comments below. Stay tuned for the upcoming videos in this blood sugar control series. We'll see you on the next episode of Dr. Hanz, MD, where we 10x your success by optimizing your health. All types of physical activity can manage blood sugar. The key is committing to moving your body throughout the day, every day.